Connect the power cable between the generator and the socket. Insert the negative plate connection cable into the right lower interface on the front panel of the generator. Open the clip at the other end of the connection cable. Place the metal surface of the negative plate facing up. Insert the raised part of the negative plate into the bottom of the clip and close the clip. Shave areas of the animal with a large flat surface, thin fat layer, and rich blood vessels, such as the chest, abdomen, thighs, or buttocks, to ensure full contact between the exposed skin and the negative plate. Insufficient contact can cause skin burns. The negative plate should be positioned at least 15 centimeters away from the surgical site to reduce the potential for burn injuries caused by skin effect. If the animal is connected to an ECG electrode, the negative plate should be placed at least 15 centimeters away from the ECG electrode. The temperature probe plug has a convex and concave side. Insert the convex side facing left into the socket on the right lower part of the front panel of the generator. Choose the appropriate model of RF ablation needle based on the size of the tumor. Doctors can compare the white rubber ball inside the packaging of the different models with the tumor size to select the right needle. The working part of the ablation needle is the tip at the front. The markings on the working part are slightly lighter than those on the non-working part at the rear, and the difference can be felt with a finger. During insertion, ensure the entire front working part is inserted into the tissue beneath the skin to prevent burns to the skin surface. Insert the RF ablation needle plug into the socket on the right lower part of the front panel of the generator. Open the peristaltic pump lid. Place the part of the water cooling circulation tube with the arrow pointing to the right into the peristaltic pump's roller groove and close the lid. Take a clean container, such as a water bucket or beaker, with a capacity of at least 500 milliliters, and add purified water not exceeding 26 degrees centigrade. Place the container below the peristaltic pump. Submerge both the inlet and outlet of the water cooling circulation tube in the purified water and monitor the water inlet during the procedure to ensure it stays submerged to prevent water supply interruption, which could cause overheating of the ablation needle. Turn on the switch on the back of the generator. The power button on the front panel will turn blue. Press the power button to start the machine. Press the peristaltic pump start button on the screen. Observe whether water flows out from the outlet of the water cooling circulation tube. If water flows, run the pump for 30 seconds and check for air bubbles in the tube. If there are no bubbles, stop the pump and enter standby mode. Hold the ablation needle handle with your hand and insert the needle into the tumor. Ensure the working tip of the RF ablation needle follows the tumor's center as closely as possible. After insertion, use a clamp to fix the needle in place. For superficial or shallow tumors, place the front end of the temperature probe directly on the skin at the closest point to the tumor and secure it with a clamp. Note that the temperature probe can only be used for subcutaneous temperature measurement when the tumor's edge is within 5 centimeters of the skin. For tumors further from the skin or in the abdominal cavity, open surgery or an incision must be made to establish a pathway for the temperature probe to approach the tumor's edge. During the ablation procedure, ensure the stability of the clamp base and that the temperature probe is in close contact with the skin. Also, monitor whether the ablation needle moves due to tumor shrinkage. If the working tip of the needle is exposed on the skin, stop the procedure immediately to avoid burns. After adjusting the needle position, the procedure can resume. In Intelligent Ablation mode, click the Intelligent Ablation button on the screen to start the procedure. Doctors can monitor the progress by observing the boundary temperature on the screen. The ablation power will be dynamically adjusted based on the boundary temperature and impedance. When the boundary temperature reaches 60 degrees centigrade, the system will automatically stop the procedure and prompt the doctor to withdraw the RF ablation needle. In manual mode, it is recommended to set the ablation time to 15 minutes or longer. For tumors with a diameter of 2 centimeters or less, set the power to no more than to 5 W. For tumors with a diameter of 3 centimeters, set the power to no more than 30 West. For tumors with a diameter of 4 centimeters, set the power to no more than 35 West. After setting, click Manual Ablation on the screen and monitor the progress by observing the boundary temperature. When the boundary temperature reaches 60 degrees centigrade, click the screen to end the procedure. Note, After starting the ablation, if the impedance exceeds 200 or an impedance to high warning appears, it indicates that the RF ablation needle is too close to the negative plate, or the working tip of the needle is not fully in contact with the tissue. Adjust the needle position and continue the procedure. For non-spherical or irregularly shaped tumors, the doctor can perform ablation in multiple areas. For large spherical or near-spherical tumors, it is recommended that the doctor adopt a multi-region ablation approach. The lifespan of the ablation needle is approximately 15 to 20 procedures. If the generator screen indicates that the needle has reached its lifespan limit, replace it with a new one. It is recommended that doctors proactively replace the RF ablation needle after 15 uses to avoid impacting the surgical progress. After the ablation procedure, remove both the inlet and outlet of the water cooling circulation tube from the water. Press the peristaltic pump run button to drain the cooling water from the tube. Turn off the generator by pressing the power button on the left lower part of the front panel, and then press the boat-shaped switch on the back to power off. The water cooling circulation tube can then be removed from the peristaltic pump. For convenience during the next procedure, the ablation needle plug can remain plugged into the generator. This concludes the usage instruction for the Veterinary Tumor Radiofrequency Ablation System. Thank you for watching.